What do you like? Tell me what you like.
There's value in that because it almost gives the brain like a vacation, right?
Holistic health is completely underappreciated, but so critical.
Eating whole foods, and
the key is just to find something that you really enjoy.
Welcome to the NAMP Nourishing You podcast. I'm Kristen Burkett.
And I'm Diana Wally. We're your hosts for NAMP's podcast dedicated to connecting holistic health enthusiasts with each other to share practical information from the holistic wellness space for enhanced vitality.
Diana and I are master nutrition therapists, board certified in holistic nutrition with private practices and an online joint venture that supports clients and practitioners as they strive to reach their full potential. We're honored to be hosting this podcast for NAMP and connecting our listeners with the latest in holistic wellness.
And if you enjoyed today's show, help us out by commenting below, liking this video, and subscribing to the channel to help us spread the word.
This episode of the Nourishing You podcast is brought to you by Designs for Health.
Hi, everyone. Welcome to this episode of the Nourishing You podcast. We're looking forward to talking with Dr. Betsy Greenleaf today about pelvic floor health, a topic so critical to women's health but so underdiscussed. Renowned as a premier expert in women's health, best-selling author, entrepreneur, spokesperson, and innovative specialist in female pelvic medicine and reconstructive surgery for over 2 decades, Dr. Greenleaf is a true trailblazer. She made history as the first female to achieve board certification in urogynecology. She is also the founder of International Pause Institute, giving those in perimenopause, menopause, and andropause their life, energy, and sanity back. She is also the CEO of Pelvic Floor Store, your online resource for pelvic floor health. Dr. Greenleaf's approach is holistic, focusing on body, mind, and spirit, guiding countless busy women to discover pelvic peace, inner strength, and reclaim their confidence. A captivating speaker and respected educator, she infuses humor and warmth into conversations about sensitive health topics, aiming to normalize discussion around women's health and well-being. Dr. Greenleaf, thanks so much for joining us today.
Thank you. That was, man, your introduction is so awesome. I love that video at the beginning of your podcast. Well, for the people who are listening to the podcast, you're not going to see that, but for the YouTube people, it was a really awesome graphics on there. And a lot of faces I recognized.
Yeah, thank you. I know I was saying before we started rolling how I'm started kind of dancing in the background to that. I know I love that. I love that song.
Yeah.
So it's so great to have this opportunity to talk with you and to get more information out to our audience about this topic that I admit I don't know very much about, but I can't wait to learn from you. So many women have related issues, but aren't sure where to turn. And maybe this topic is even a little awkward, a little embarrassing to bring up on a coffee date with a friend. So I know we're going to help a lot of people. But to kick us off, we'd love to hear a recap of your story and how you came not only into the holistic field, but into this specific area of focus.
Yeah, well, it's interesting. I mean, everyone laughs because patients are always asking me how did you go into gynecology? How do you look at things down there all the time? And I don't really realize it. And I actually didn't start off thinking I wanted to be a gynecologist. I actually wanted to be a pediatrician and loved the kids, but interestingly enough, hated the parents. And I'm connecting this now, it actually had to do with nutrition, because one of the things that drove me insane when I was doing pediatrics was I was seeing parents that were watering down baby formula because they were either too lazy to go buy more formula or too poor to go buy the formula, or were, not breastfeeding. They just weren't taking care of and feeding their kids properly. And it just drove me insane. So I actually went through medical school and found myself really attracted to the surgical specialties because I liked being able to kind of change things in people's lives very quickly. But I very soon figured out I didn't have the personality for general surgery because I was the person on my rotations after someone had their appendix out. I'd go and see the patients and I'd be like, "So how do you feel now that your appendix is out? How do you feel?" Like I wanted to know the person and really get in. And the people were like, "What? I just had my appendix out." Like, and general surgeons, though they're really good at what they do, they're kind of like body mechanics. They're not like the feely, touchy, warm, huggy type of personalities. So then I found myself in OBGYN, obstetrics and gynecology, but I really liked the surgical aspect of it. And so I really liked my urology rotation. I really liked general surgery. I like gynecology. And then all of a sudden I found out urogynecology, which there's only 1,500 of us in the United States. I found out it was a specialty. My very last rotation in residency. And so next thing you know, I told my parents like, "Hey, I'm going to go do 2 more years of training and in urogynecology." And my mom's first response was, "What is that? Like is it like European gynecology? It's like fancy gynecology because it's the euro."
That's
And I'm like,
hilarious.
"Yeah." And I go and then I joke because I'm like, "Yeah, it's European because we deal with like you are peeing because we're dealing with urine in the bladder, and we're dealing with all the pelvic organs." So it's a combination of urology dealing with the urinary system and gynecology dealing with the reproductive organs. And we actually even deal a lot with the lower colon. So we're dealing with the gastrointestinal system too. So
Wow.
and then, even then connecting it with this holistic health, that didn't happen until I was out actually practicing. Because you come out of training and you're like, I know everything. And then you start doing things on patients and like it's not working. And I quickly was like, wait a minute, the tools that I learned in traditional medicine aren't really getting anyone any better. I'm just handing them pills and then more pills and then more pills, and they still have the same problem. So it really kind of came into like, I needed to figure out what was the problem that was really causing the underlying issues. And I also have to thank my medical training in that I did a osteopathic training, and in osteopathic medicine, we look at the body as a whole. So we go, all right, you know what? Maybe someone's having symptoms in their little pinky finger, but maybe it's from like, some problem in their gut or a problem someplace else in their body. So we don't compartmentalize like the traditional allopathic MDs do. So it was a combination of having that belief and training and then me wanting to dig deeper and deeper. And the funny thing was that the more I got into this and the further I went down, it all just pretty much ended leading me to gut health being the source of a majority of health conditions. And that's what I honestly believe, that 90% of medical conditions are either caused or worsened by gut health, which then we can take back to diet. So,
Oh, interesting. Well, isn't that something that, like, in your very last area of medical school and residency, you found what really was going to be the thing for you? That's so
yeah, I didn't even know it
cool to happen.
existed before that.
This news to me too, but it's good. I think maybe a whole lot of people now know that there's this specialty that maybe didn't even know that it existed. So that's awesome. Well, we're
And I
certainly glad that you got to this space and you approach it in the way that you do. That's right up our alley. So,
and it was really interesting. I was just having a conversation with one of my colleagues today who's a gynecologist who same thing, got frustrated with traditional medicine, is now going into through that integrative training. And she said she was counseling a patient on diet today. And the patient was like, well, I don't understand. Like, how is that going to help my pelvic symptoms? Because people don't connect what you're eating with what's happening down below, or what's happening with your sex drive, or fertility, or recurrent urinary tract infections, or recurrent vaginal infections. But it all is connected.
yeah. Well, I think it could be a really big topic, overall pelvic floor health, but maybe we'd like to see if you can help give us just a good overview to start with, maybe a basic education to start about what pelvic floor health means. What all are we talking about here? I mean, you mentioned down there, what are all the different parts and systems involved, and what are the related functions? And help us just understand what pelvic floor health encompasses.
Sure, sure. Well, I think, first of all, I think the word pelvic floor is kind of a misnomer. I mean, the pelvic floor itself really means just the support structures that are holding all the organs like the bladder, the vagina, the uterus, the rectum. And in men, it's holding they don't have the uterus, but it's holding all their pelvic organs in place. And that's really just the muscles, the ligaments, the nerves, everything that makes that up. That's kind of like the lower pelvis, like the bottom part of like our pelvic, brim of bones. But when we talk about pelvic health, and a lot of times we use the word pelvic floor because it's easier to kind of talk about, we're also talking about all the organs basically from the belly button down and from the upper thighs up. So anything that falls in that area. So it's usually going to be things like the bladder, in both sexes. It's going to be reproductive organs in both sexes. It's going to be the lower colon, and some of the intestines. So it's going to be all those areas, along with, blood vessels and nerves and ligaments and muscles that are holding everything in place.
Okay. So it seems like a lot of different symptoms could lead you to lots of different physicians given that
Yes.
region. You could go on
Yes.
lots of different rabbit chases trying to, based on where your symptom might be coming from. So this is obviously your specialty is different than just going to a regular physician or a gynecologist. But what are some of those symptoms that we might see that would lead us to see a urogynecologist?
Yeah, so the typical ones for women we see is incontinence. Incontinence is leaking, and that can be leaking when you cough, laugh, sneeze, which is something called stress incontinence, which is usually from a weakness of ligaments in the pelvis. Or there's overactive bladder with both sexes. Overactive bladder is like you're sitting, you're fine, all of a sudden you're like, make way, I got to get to the bathroom. Just remember the commercials. It's like, gotta go, gotta go. That is what's an overactive bladder. And that can start as early as in your 20s. But by time people reach their 70s, there's more people walking around at any given time with an overactive bladder that has a common cold. So that's really, really common. Though men will tend to see a urologist for these issues or, their general doctors. Women will see their gynecologist, a general doctor, a urologist, or a urogynecologist. Other symptoms may be if there's pelvic pain. So that can be any of the pelvic, like pain with sitting, pain with intimacy. Um, we also in urogynecology deal a lot with what's called prolapse, but people don't really understand. The prolapse is where the ligaments that are holding everything in the pelvis start to get weak, and now the organs start to droop and drop. And so 50% of women can develop a prolapse at some point in their lives where the bladder might start dropping and kind of bulge through the vagina. The uterus kind of starts dropping or the rectum starts dropping. But most people that have that don't go, oh, something's going on down there. It must be a prolapse. Usually, what people happen is all of a sudden they feel like a heaviness in their pelvis. They may see something bulging out between their legs. And usually, the first thing that somebody does when they see something like this is they panic and they're like, oh my God, what is that? Do I have cancer? That's usually the more common response when it comes to symptoms. And then with myself, I really had a passion towards not only the pelvic pain conditions, but also the recurrent infections. So recurrent bladder infections. So they may be symptoms may be like burning when urinating, like an odor when you're urinating, blood in the urine, or any kind of like intimate down there itching, burning odor that may be signs of an infection. So those are all kind of the symptoms that tend to happen. Also, as we age, the other thing that our profession covers is some of the changes that happen with menopause and perimenopause, such as more discomfort with intimacy, dryness in the vaginal area. So, yeah, so that and then pelvic pain, pelvic issues for men that would see a urologist would be if they're having problems with erectile dysfunction.
Okay. So when you said up to 50% of women may experience a prolapse, that number really shocked me.
Yeah, and
I
then
had no idea it was that big.
80% of women will have a pelvic health problem at some point in their lives.
Wow.
And the scary thing about it is 65% of women are uncomfortable saying the word vagina. And I always say, if we can't talk about it, how are we going to, how are people going to heal? How are they going to be able to ask for help? How are we as healthcare practitioners going to be able to talk about it with them? So I'm trying to normalize, like, let's just say the words. And then I know that the vulva police start coming after me on social media because technically the vagina is just the tube on the inside and the vulva is everything that's external. So I'm just happy if somebody calls it something, and
We
we can
we
talk about it. I don't care what you call it. Like, I don't care if we don't get the terminology right as long as we're talking about it.
Yeah, with my daughters, we like to call it the vajayjay. Is
Yes.
that might be from Grey's Anatomy? I don't know. But just quick story, one of my best friends for years, I mean, 30 years, was a elementary school teacher, and in 5th grade and had to teach sex ed. And so the very first day she's like, "Okay, everybody, here's what we're going to do. We're going to say vagina like 50 times. We're going to yell it, scream it. So we're just going to get that out of our system. And it's just a word." So
Yeah.
she said one day the principal walked by and her whole class was like, "Vagina, vagina, vagina, vagina." I mean, you can't make it up. So funny.
I
But I'm
love
like,
that.
good. We should
I
be.
want to meet that person. I love
She's
that.
hilarious. Yeah, she's hilarious. Yeah.
And that's what I tell people. I'm like, even if you have to get in the mirror and just say it like in the mirror a whole bunch of times until I did not ever think I'd be saying vagina like it's like nothing, but same thing, you become desensitized. I've said it so
Yes.
many times in my life. Sometimes I forget, and sometimes I'm in polite company and I just drop the V word. And then of course I'm always in Facebook jail because apparently the word vagina goes against community standards. I've gotten kicked off of Instagram once before. So yeah, I gotta watch my bad language.
Listen, YouTube, don't put us in YouTube jail, please. We don't. I know we want to get out a free jail card.
I
It's
know.
such a crime to talk about a body part. I mean,
I know.
Right.
I mean, like, really, if you like sprained your elbow and you were like walking around and somebody's like, "What's happened?" You're like, "Oh man, I twisted my elbow or I did something to my elbow." Like, we don't talk about like,
Yeah.
like when you're having like a yeast infection, people are like hiding it. I always joke that I'm in a bunch of different media groups and they're always encouraging us to, get on TV to like find things that happen in the news and like piggyback on that. And I said, well, you know what? I'm never going to be like, "Hey, news at 10, Kim Kardashian has a yeast infection." Like, I'm never going to be able to piggyback on that because it's never going to happen.
Yeah, so crazy.
So,
Well,
yeah.
maybe we can dig in a little bit more. So, Kristen and I were thinking that maybe we could, pick 3 of the most common conditions that you see, and you mentioned several. Leaking urine, maybe pain with intercourse, prolapse, infection, menopausal dryness. So maybe we could pick 3 and talk about, what are the risk factors for those 3, and maybe, what are some remedies. So maybe we could talk about both of those. We're going to get into gut health a little bit later, but
Okay. All right. Sounds good.
so are there
Well,
3 that come to mind that you see that are most common?
yeah. Well, I mean, the vaginal infections and the bladder infections are really common, but I'm going to tie that into gut health. So maybe
Okay.
we'll save that for later.
Perfect. Okay.
So
Great.
maybe we'll do the incontinence.
Perfect.
And there's, like I said, there's 2 types of incontinence. There's leaking when you cough, laugh, sneeze. That's called stress incontinence. And then there is urge incontinence. And, maybe we'll do urge incontinence. That's the one where you got to go. They don't know exactly what causes it. There's a lot of different theories. And I think there's a lot of different like causes. We do know that nerve compression in the back can cause it. We know it gets worse as we get older. It can start as early as in the 20s. But many people just think that like when it starts happening, like the adult diaper industry is a multi-billion-dollar industry. And a lot of people, because they don't talk about it, they just go, "Oh, this is just what it's like to get older." And they just start wearing Depends. And I'm telling you that there are so many different treatments. Um, the easiest thing is sometimes there's foods that can irritate the bladder. So if somebody has what's called an overactive bladder, it can be made worse by different foods that we eat and the foods that tend to be more acidic. like things like tomatoes, citrus fruits, alcohol, coffee. Unfortunately, even if it's decaffeinated, the acidity in the coffee can be irritating. Um, we do tend to do better with like herbal teas tend to be more soothing. Chocolate, unfortunately, is another one. So things that are really kind of strong and very acidic, anything that's very high in vitamin C, because vitamin C is filtered by the kidneys and stays in the urine. That's how we get rid of it out of the body. And so, sometimes you'll hear people where like they have a cold and all of a sudden they're taking like vitamin C and then all of a sudden they're having problems where their bladder starts burning or they're getting more leakage. And it's like, well, there could be an underlying issue going on with the bladder. So,
So you see people pulling these foods out of their diet and then their incontinence improves.
it can be. It
That's
can. It's one of the
amazing.
first things that you can do is like, maybe get rid of that orange juice and coffee in the morning. The other thing that I see people do all the time, which is very counterintuitive, like what you should be doing and what people actually do. But when people are urinating a lot or going to the bathroom a lot or getting up at night many times, they tend to stop drinking. They figure like, well, if I don't drink fluids, then I won't have to go. And it's actually the opposite because what ends up happening is when we dehydrate ourselves like that, it actually concentrates the urine. And our urine is like is a waste product. And so there's a lot of salts and electrolytes in there. And the more that we concentrate the urine, the more irritating it is to the bladder, and it can actually aggravate bladder problems. So drinking more fluids, we can actually dilute the urine, and the urine's not as irritating the bladder. So that can sometimes help with when it comes to these overactive bladder symptoms. I mean, there's gonna be like a level at which you're drinking more fluid, you're just going to be making more urine, you're going to have to go more. But typically urinating 8 times a day is considered normal depending on how much you're drinking. And getting up at night, as annoying as this may be, 2 times a night is considered normal. Anything beyond that is abnormal, and that's when we really need to start looking into things.
So that's pretty interesting because I think I didn't know it was normal to get up in the middle of the night. And I think that's a real misconception, is that we should be sleeping all the way through the night without getting up and having to get up to go to the bathroom.
Preferably.
I mean, we'd rather, but it's not abnormal or to be concerned about if you're getting up 1 or 2 times to go to the bathroom. Now, what about for those people that are getting up more than that? Because I know I do hear that quite often, especially with elderly people, that they have to get up several times a night, more than once or twice.
What's super interesting about that? And I find so many times that people look at me and it's so hard to convince them. But I go, you know what? There might be an underlying sleep disorder and that we need you to see a sleep doctor. And they're like, but I'm waking up because I'm peeing. And I'm like, that's what you think. Sometimes people have a sleep disorder and they're not getting into a deep enough sleep to ignore those signals of the body. And I can't tell you how many times I've had patients go to a sleep doctor, found out that they had like sleep apnea where they're stopping to breathe in the middle of the night and then they're waking up and then they get the sleep apnea fixed and now they're not peeing at night anymore. The other thing that doesn't seem related with the getting up at night is there could be an underlying heart condition. So the heart is just a big giant pump and its job is to pump our fluids around our body. And so if the pump is not doing a good job and during the day we're upright and maybe some people are getting swelling in their legs and they're not thinking anything of it. But now when you're laid down and you're laying on an even playing field, the heart can pump more efficiently. And if it can pump better, then it can pump blood to the kidneys better and the kidneys can filter it and make more urine. So there could be an underlying heart condition, especially with the getting up at night. So, and there's some other things that go on with like kidney conditions and certain chemicals that can affect people who make urine at night. And I have to say, one of the traditional medicine treatments for what's called nocturia, which is getting up to go to the bathroom at night, is a medication that stops the kidneys. And I'm like, I hate that medicine. I'm like, why? Like, yes, you're gonna sleep, but like, why would we stop something that the body is supposed to be doing? But that's where I always tell people, ask your doctors about the medication that you're getting. Like, what does it actually do? And do I really need this? And are there other more natural, holistic things I can do?
Yeah.
So, yeah.
Those connections are so interesting. I never would have put some of those together.
Yeah.
But
Yeah. This
yeah,
is where the body is amazing how everything's connected.
exactly. Exactly. Okay, so we talked about the need to get up multiple times. We talked about that urgent kind of urination. What else do we want to address?
Yeah. So, I was even thinking some of the pelvic pain conditions. So I can't really talk about any of this stuff without talking about diet and gut. So I said I was going to save it for later, but you know what? Before
You can
maybe we'll
mix it up if you want to. It's okay.
yeah, let's actually do prolapse before we get into the gut stuff because the gut
Okay.
stuff gets really interesting.
Okay.
So prolapse is there's just a very thin ligaments between the bladder and the vagina and the rectum. And they basically kind of sit on each other and they just kind of lean. There's ligaments that hold the uterus up. So everything's kind of like leaning on each other. And then unfortunately, pregnancy, childbirth, that's probably the number one cause to damage to those ligaments. Because nature doesn't really care if your vagina is staying in place. It wants to get the baby out. That's what it's, meant to do. And, if things are flopping around later on in life, nature doesn't really care about that. The other thing is you don't have to have had children to have a prolapse. Sometimes like our pelvic health, like our pelvic floor, we just have our hip bones that are surround our whole body. And then the pelvic floor is just a big hole open to gravity. So you just have some muscles and skin and some connective tissue that holds everything in place. So things like constipation, like bearing down, puts a lot of pressure on the pelvic floor, and you can damage the pelvic floor that way. Lifting heavy objects. This is why when we see the weightlifters, they're blowing out as they're lifting because they're trying not to give themselves a hernia. And a prolapse is basically a pelvic hernia. It's basically where things are kind of drooping and dropping and they are not being held up anymore. And so this is why, unfortunately, because women giving birth, they are at a little higher risk. I mean, men can get prolapses, though they tend to get rectal prolapses than anything else. I mean, we have, unfortunately, the vagina where everything can kind of flop in and kind of out. So we have more areas where the ligaments can kind of lose their place.
Is there anything we can do to strengthen those ligaments, or is it so internal that we can't really do much?
Well, the interesting thing is the muscles in that area can help a lot. Now, we start losing 8% muscle mass for every decade that we're alive. And people think about exercising their arms and their legs, but nobody thinks about doing their Kegels until it's too late. And then it's a little bit harder to reverse with Kegels once you have a prolapse than if we're just you can, but you want to be doing your Kegels the whole time. So now, once those ligaments are torn, you can't really repair them. Even surgically, they're very difficult to repair. There are different types of surgeries, but even then, they're not considered like lifetime fixes. But I would tell you, like, I don't want to scare anybody. I would say talk to your doctor if you are dealing with one of these things because there's so many options. But doing those Kegels are probably, not lifting anything heavy, trying not to get constipated, and doing their Kegel exercises. And a lot of people, there's a this idea of how to do Kegels. I know a lot of women will be like, "Oh, I do it every time I pee," and I'm like, "Wait a minute." So it's always been told to the muscles are the ones that you're using to stop the flow of urine, but you just do it when you're urinating to try to figure out where those muscles are. You're not supposed to do that every time you pee. And I hear that from a lot of women. They're like, every time I pee, I do my Kegels. Well, if you're doing it every time you pee, the problem is you're stopping the flow of the urine, and the bladder's a big muscular bag. It's going to keep pushing. And the urine's going to go where the least amount of pressure is, and that could be up to the kidneys. So it does increase your risk of kidney infection. So you don't want to do it that way.
So how should we be doing it?
You can do it. You can do it like right now while we're talking.
Okay.
So you can do it any other time. Like I tell people to think of, and I can't take credit for this. I stole it from somebody and I can't remember who told me this, and I love this idea. But they're like, have you ever drank like a really thick milkshake and you had to like really suck very hard through a straw? Think of a giant straw coming from your pelvis down into a big milkshake. and you want to suck that milkshake up into your pelvis. So the Kegels is a lifting. I think it's a tightening and a lifting. A lot of times, if you think about holding in gas, like holding in a fart, that's the same muscles. That's sometimes easier for people to understand than like, all right, just do your Kegels or like stopping the flow of urine. So it's going to be like a lifting and tightening. And it can be done where you like lift and hold really tight for as long as you can and then relax, maybe to a count of 10. Or you can do what's something called quick flicks, where you just go tight, tight, tight. And every time you like relax, it's like a tighten and a relax really quickly. It works different muscles. But there's also other exercises you can do, like laying down on a floor with your knees bent and you lift your pelvis off the floor. Like I think, sometimes there's images of like the 1980s aerobics where people were doing these pelvic lifts, but that will actually, tighten the pelvic floor. Or I'll tell people to sit in a chair and then take either a ball or a towel or a pillow and with their knees bent, sitting in a normal chair, stick it between their legs and just squeeze against that pillow or ball resistance. That will activate the pelvic floor too.
Interesting.
Yeah.
How often do we have to do them?
You know what? Usually I tell people to do them, if you can get like 10 repetitions in a day, and then, minimally. And then I would, see, the thing is, you're not going to like, just like any exercise, you're not going to like start lifting 100 pounds the first time you lift weights. So you're just going to do it maybe like twice a week to begin with. And then you can add 3 times a week. And then you can add like every day, like once a day or even twice a day. You don't really need to do them that much. Like I tell people, do them when they're watching TV. We used to tell people when there was commercials on TV that now everybody fast forwards the commercials. But with the commercials, we'd be like, every time there's a commercial, do your Kegels, Sometimes we'll be like, every time you stop at a stoplight when you're driving, do your Kegels, something to, get into a habit, something that you remember to do it.
Right.
That's great.
And it's not just great. So it's great for holding in your urine. It's great for holding in bowel movements because we don't want to get fecally incontinent, stool incontinent as we age. We don't want to be, farting in front of everybody. So it's going to help you hold in gas and not embarrass yourself. And it's great for sexual health because it helps with, for men, it can help with premature ejaculation. And for women and men, it can help with orgasm and holding on to an orgasm and having better sexual function. So it's good for so many things when it comes to pelvic health.
Well, I'm going to start doing my Q. Actually, I'm doing them right now.
Right now.
Right now.
Designs for Health offers superior natural products and the most innovative functional lab tests available. Dedicated to designing a well world driven by a higher purpose. The Designs for Health team believes in science-based nutrition and natural medicine, developing health products without compromise, and advancing the way education and technology support wellness for all. At Designs for Health, holistic thinking comes first. Functional medicine becomes conventional medicine. Supplements and lifestyles converge. A wellness epidemic begins.
Oh,
Yeah.
okay. So I think that we probably want to talk longer about this next piece than we probably want to spend time on. But let's talk about this interconnection with the gut and the pelvic floor and that whole.
Yeah, this is my favorite topic. This one gets me so excited because I love talking about like the brain gut vagina connection or the brain gut pelvic connection because this is for men and women. But like I always start with the gut because it's probably the easiest place to start. And I think, interesting enough, and you guys know this, but for the audience, like 90% of our happy hormone, serotonin, is made in our gut. And 80 to 85% of our immune system is made in our gut. So if our gut is off, then other things can be off. And there's this whole beautiful like microbiome, which is the bacteria and organisms that live on our skin. And the microbiome is different in our mouth than is in our gut, than is in our vaginas. And each area kind of connects. And so unfortunately, if we're eating that standard American diet, we know that these foods can be very inflammatory and they can lead to something called leaky gut, which I'm sure you guys have talked about before. Another thing that I've stolen from somebody, but I love this idea of leaky gut being explained as a coffee filter, and that the intestines being that coffee filter. And let's say you eat a hamburger and your body's breaking it down, and then it's breaking down into its like minerals and its proteins and its amino acids, and now those little tiny components are filtering through that coffee filter into your bloodstream, and your body goes, this is great, these are all the ingredients I know need to heal. And just like if you poured hot water over a coffee in a filter, on the other side you get nice brown water that tastes like coffee. Now, if there's holes in that coffee filter and you pour hot water on the coffee filter, and then all of a sudden you take a big swig, you get a mouthful of brown water and a bunch of coffee grounds. And you go, wait a minute, this is not the coffee that I recognize as what I normally drink. So that's what can happen to the gut when it comes to so many things like environmental toxins, medications, emotional stress, inflammatory foods. So many different factors can cause like little holes or gaps in the intestine. So now when you eat that hamburger, instead of like the nice amino acids and the like the minerals and the vitamins of that food coming through into the body, you'll actually get like little pieces. I always picture like little hamburgers floating around in your bloodstream, which is, it's not going to be actually be a hamburger floating around your bloodstream, but it's going to be a piece of material that the body doesn't recognize as hamburger. And it goes, wait a minute, I don't recognize that as something I can use as a building block. Like that must be foreign. And so because it's foreign, I need to attack it. And so your immune system will go attack it. And sometimes that can develop into food sensitivities if we become like too sensitive to, in this case, like hamburger meat. Or the body can get confused and it goes to try to attack that hamburger, and it accidentally turns and starts attacking your own cells. And that's where we end up getting some of these autoimmune conditions. So bringing that all together in pelvic health, you're like, okay, wait, how's this all connected to pelvic health? The other thing I see is a lot of those symptoms, a lot of the gastrointestinal symptoms, a lot of the mental health symptoms like anxiety and depression, we see in patients that have pelvic health problems, because the pelvic health issues are not the problem. It's usually coming from a leaky gut. And so we often will see that the bacterial balance in the gut gets thrown off. Maybe if someone has a diet that's high in sugars, we sometimes will see they get an overgrowth of yeast in their gut. And now they might not have gastrointestinal symptoms, but they may be getting recurrent yeast infections. And in women, that will be like vaginal infections. And men and women, that might be jock itch or like groin yeast. I've seen it as much as people getting really severe dandruff, or even what looks like psoriasis being more of a skin yeast infection. So it's really like looking at the diet and what is going on with the foods that people are eating, and how's it, and what kind of stressors are they being exposed to, and insecticides and pesticides, and how is this throwing off the microbiome. And especially as women, because our anus and our vagina and the urethra, the tube we pee through, is so close together, it's very easy for bacteria from the rectal area to kind of get into the vaginal area, no matter how clean you are. And that sets us up for recurrent vaginal infections, but also the vagina can be a reservoir for recurrent bladder infections, because it just brings those bacteria and those organisms even closer to the bladder. So these things are even very interconnected. And I think what's more interesting is this I've gone down like rabbit holes of the research in like PubMed, and it's out there, is the connection between the microbiome of the gut and the microbiome of the vagina and sex drive. And this I always find super fascinating, because the body's so smart that it knows when things are not right. So when our gut is not right, or our vagina is not right, or something's inflamed, the body goes, well, this is not an ideal time to be reproducing. And so it will shut down all processes of reproduction. So that may be affecting hormones and maybe affecting menstrual cycles. It's going to also affect sex drive. And so, because I always say sex and stress can't coexist, because it's either we're in a nice, relaxed, healthy reproductive mode, or the body's in cortisol, like I'm stressed in fight or flight mode. So, I see too many people like nowadays are going to their doctors and they're like, especially perimenopausal women or menopausal women or older men, and andropause. Anybody, let's say anybody 40s over are going to their doctors and they're like, oh, I have a low sex drive, like give me hormones. And then they're going on hormones and they're still not, it's not doing anything for the sex drive because the hormones are just a tool that we also need to be looking at what kind of stress is the body under, what kind of inflammation is happening. Is there something that we're eating or doing to our gut that is causing this response too? And, are there any kind of pelvic symptoms that are going with this? So,
Yeah, that's
connected.
incredible. Do you have any pillars, dietary pillars that you recommend to your patients for healthy pelvic floor?
Everyone laughs at me. First of all, I said there's 4 things you should be eating.
Okay.
Your food should fall into one of 4 of these categories. It should have at one point flown, swam, walked, or grown. Because I always say Twinkies don't grow on trees, Doritos are not
They
walking.
don't?
There's no like free range Doritos. So if it falls into one of those 4 categories, then it's something you can eat. So that's the simplest way. But I also talk about as cave people, we did not evolve to have refrigerators. And I'm not saying get rid of your refrigerators because there's a lot of food safety issues that we want to, keep our food safe. But we were eating a lot more bacteria at one point. And so we need to replenish that bacteria by eating fermented foods.
Okay.
And the nice thing is there's so many options. Like I make my own because it's fun. And I kind of started that during the pandemic when I was stuck home and couldn't do anything else. So, but you can go buy so many of these. Like I like kombucha, which is fermented tea, or there's different sauerkrauts, but you got to make sure you're getting the ones that are fermented that have to be refrigerated, not the canned versions. Same thing with certain pickles, kimchi. I give yogurt a pass. I know sometimes dairy gets categorized as inflammatory, but I don't have as much of a problem with yogurts and some of the fermented dairies as long as somebody doesn't have an issue with cow milk, or because a lot of the milk sugars are broken down during the fermentation process. So I tell people to get some sort of fermented product in their body every single day. And it's not just enough to get the bacteria now through these foods in our body. We have to feed the bacteria, and we do that through fiber. And we know that Americans are, notoriously deficient in fiber. We're not eating enough vegetables. But, they say average 25 to 30 grams of fiber a day, but I've heard even that we should be eating a lot more than that. And that the bacteria needs that fiber to survive.
So everything's connected, right? We just can't get away from diet, like no matter what. Every body part has a connection. So it's always so interesting with that. So are there some other strategies in addition to diet that you think we should be paying attention to?
Yeah, definitely. I mean, I think it's going back to the basics. I always tell people that like whole wellness is like a 3-legged stool. And if each leg represents like body, mind, spirit. And then this is where like practitioners like ourselves, we can affect someone's body, but only to a point. We can't exercise for them. We can't sleep for them. We can't make sure they're drinking enough fluids. So we need to be making sure we're doing that, but also addressing mental health and spiritual health. And spiritual health may just be, people look at it different ways. It may be actually practicing a religion, but it could be just like having friends and being around other, like a community and having that kind of connection with people. So it's got to be all 3 legs have to be equal for the body to be fully healthy. Otherwise, if you have too much of one and not enough of the other, that 3-legged stool just kind of falls over. So, and then going back to the basics, I mean, we're not sleeping enough. There's been statistics even just saying that like 6 hours or less a night, your risk of obesity goes up 37%. And if you're getting 5 hours, it goes up even higher. So we really need to be getting 7 to 8 hours of sleep. And that's also going to support the microbiome. So, because anything that we do that's going to kind of decrease stress is going to support our microbiome and our gut health. So the simple things like, and I tell people like you can't just go from like, if you're a person that was getting 5 hours of sleep, you can't just all of a sudden like lay down at bed and go like, all right, well, I'm going to bed 3 hours earlier because you're just going to stare at the ceiling. I'll tell people to back off their sleep by like 15 minutes. If they can do it every night, great, but they may have to go like, all right, well, let's go 15 minutes for a week and then 15 minutes for another week, and then kind of eventually get on a cycle where you're doing 8 hours straight. You know, it's been argued, it's been out in the press that 75% of Americans are chronically dehydrated, but there's not actual research that backs that up. But I do believe that Americans, we're not drinking, and not just Americans. I just can speak, that's my experience. If you're listening from someplace else, is that we're just not drinking enough fluids. And so that's going to depend on our activity levels, but they're saying about 96 ounces of fluids a day, non-caffeinated fluids. It doesn't necessarily have to be water, it's because I've had some people who will drink other things and then they're trying to get their water on top of it. That's fine, but make sure you don't have a medical condition where you have to fluid restrict, because there are some kidney conditions where you can't drink that much. But staying with that whole food diet, sleeping, getting enough fluids, doing something for stress reduction. For some people that's meditation. Other people that's, I don't know, going for a hike, taking a dance class, doing a hobby, finding something. And then I always tell people, and I had to do this myself, I had to actually, if you look at my calendar, I have breakfast scheduled. I have exercise scheduled. I have shower scheduled, because if I don't schedule things on my calendar, other things start creeping in. And so it's really easy to get away from self-care when you start saying yes to all the other demands of life. So I tell people, schedule in you first on the calendar, and then everything else will find its place around it.
So schedule in those non-negotiables. It sounds like you're
Yeah.
saying, yeah, because they are not negotiable. It is so refreshing. I know Kristen would agree to hear a physician speaking so holistically. I mean, it's all of the things that Kristen and I feel are so important and that we educate our clients on. So to hear a physician speaking about all those things is so refreshing. I'm just so grateful that you're out there.
Yeah,
Thank you.
absolutely. And, for anyone that's dealing with one of these pelvic floor health issues, I'm hoping that you've got some hope now, that there are some things that you can do, and it's not just looking for a surgical option to fix everything, that there are definitely things you can try before you have to go to extreme measures. And the basics matter. I think sometimes it's really easy to gloss over, what we consider basics. I know for a lot of people, it's not their basics yet, but if you don't have those fundamentals in place, you really don't have much of a chance. And so then you are, open to just whatever the surgery or the prescription medication can offer to you, which may not really give you the relief that you're looking for. So
yeah, and even with the surgery, if you go in surgery and you don't have that body, mind, spirit balance, you're not going to heal as well. So it's really, you can potentially avoid surgery, but if you have to, you want to be in as much balance as you possibly can. And why not, especially have your gut as, healed as possible before you're going through that stress of surgery.
Yeah. Well, it may not be sexy to do all the basics, but the basics might help you feel sexy. So there you go.
Yeah.
We are definitely getting kicked off YouTube now.
Yeah, I'm sure.
Yeah. Well, do you have time, Dr. Greenleaf, for one fun question?
Yeah, definitely.
Okay. So, but I also have to say, like, kudos to you for making a potentially awkward, uncomfortable conversation really fun. Yeah, you're amazing at that. And so we love to ask our guests, how do you incorporate the things that you teach into your own life? So kind of give us a day in the life of Dr. Greenleaf, please.
Yeah, well, I kind of alluded to begin with is that I do schedule everything down to like my shower in the morning, in my eating, because otherwise it won't happen.
And you have children, so that's extra important because we know how that goes. Yeah.
I use a food tracker on a daily basis to make sure I'm getting enough protein because that's
Which one
something
do
that
you like?
I use my Fitness Pal.
Okay,
It's just,
yeah, I like that.
it just I've tried multiple and I think they're all good. It's
Good.
something that you can track,
And that's
even if it's just
free.
writing down in a diary. But
Yeah.
because I'm really focusing on, am I getting enough? I'm tracking how much fluids I'm getting because it's so easy to get busy and not drink water. So I really try to go out of my way to do that. I'm making sure for me, I've always been I've struggled with my weight for years, and I found that once I actually increased my protein in my diet, that made a big difference without actually having to do a lot else. So, so I do that, and I try to get fermented foods in my diet every single day. I will honestly admit I still lack in the fiber department. I definitely need to focus on more vegetables, even though I tell people all day long. But that's something that I'm constantly striving to get more of in the diet and kind of sneak it in ways that throw it into smoothies just to kind of get some more. So,
Yeah.
yeah.
No, that's great.
Right.
I agree with you. I don't know what you think, Kristen, but even as a nutrition professional, I will track occasionally too. And I like my Fitness Pal. And just for the listeners, there is a no cost option for my Fitness Pal. So don't feel like that there's a barrier to entry there. It's a really great app that you can use on your phone. But so when I track occasionally and I look at my fiber, I'm like, wow, it is, you really have to try to
You do.
get enough. And protein's another one, like both of those, which I put at the very top
Mhm.
for my clients of importance of foods. You really have to work at it. So tracking is such a great tool to make sure you know that you're getting enough.
Yeah, and it's interesting because I think a lot of people, well, I know a lot of my clients, they sometimes fight me on it in terms of tracking because they say, well, I don't want to have to do that much work to be healthy. But we live in such an unhealthy world that some of these basics, it really does help to track and be that conscious of it so that you don't end up with the other problems. So I do think it's worthwhile. And it's nice to hear, like, even at the level of a physician who's talking this all day long, that you see it being as important for you to do yourself. I
Yeah.
know, I do. I don't get my food in every day, but I do most days, especially on that, the protein and the fiber. And the fiber is a struggle. So I
I
think it
find
is
too
worthwhile.
with patients, if they have symptoms and if they're tracking, I can say to them, well, let's see what you ate in the last 24 to 48 hours. And is there something that's triggering your symptoms? So that's another reason I like tracking.
Excellent. Yeah, good
Yeah.
point. And it to Kristen's point, it does seem overwhelming at the beginning, but most people eat generally the same things, like the same breakfast-ish, and you can just, add from the day before or copy a meal. So
Yes.
it's, even just getting started, it might take a little bit of extra effort, but then it's pretty quick once you can, copy meals over and that sort of thing. So, but to your point about symptoms, yes, so helpful.
Yeah. Well, what a great conversation this has been. It's kind of like the word vagina. We never use it. Same for pelvic floor health. Who knew, right? So
Yeah.
I hope our daughters will know more than we did as they grow up and they can prevent some issues, before they actually happen because they knew how to take care of their pelvic floor better than what we did, right? Be more conscious of it. So for our listeners, we will have links to all of Dr. Greenleaf's social media in the notes. She has a wealth of resources. Do you want to mention your pelvic floor store? Because I found that to be a really interesting place to visit.
Yeah. So what happened that came out of I would recommend products to patients and they would be like, well, where do I find it? Because a lot of those products are not carried on Amazon. Even today, a lot of them are not on Amazon. And if they are, you don't actually know if they're the real thing because there's so many counterfeits, unfortunately, in the health world on Amazon. So one of my patients one day was like, man, it would be nice if there was just one place where we could go get everything you're telling me. And I went, oh, light bulb moment. I'll make a website and had no idea how to make a website. And I built the whole thing myself. It took me 3 months of like watching YouTube videos and like building it. But I started putting all the different products that I was recommending from probiotics to red light wands for vaginal rejuvenation, so to healthy lubricants. So and I'm always looking for new products. So I'm always looking for new things to put on there. And pretty soon I may be, I'll leak it out now. I am developing a couple of my own products that will be out there because things that I couldn't find that I needed for people, I'm in the process of developing them. So we'll start carrying our own products on the Pelvic Floor store. And actually, can I give a discount code?
Yes, please.
Okay, as soon as I get off with this, I will go create it. If you use NANP and the number 10, that'll get you 10% off the Pelvic Floor store your order. So
That's awesome. And we didn't get to touch on this today, but when we think of what we're putting down there, what's in those products is so important. I mean, you think of the direct absorption and what those chemicals can do. So knowing that you've got some alternatives for clean products and recommendations there, I think is really helpful. So I hope our listeners will explore that since we didn't get to touch on it today.
Yeah. Awesome.
So thank you. So NANP 10 at the Pelvic Floor store.
Yeah.
That's the best name. I know what I'm asking for my birthday. Yeah.
I love that.
Yeah. Well, thank you. That's all. I can't believe this went by so quickly. Thank you again for making such an potentially awkward topic fun. You're perfect for the work that you do. We're so glad that you're out there. And thank you everybody for listening. We appreciate all of you so much. We love our community. And until next time, take care, everyone.
For more information, go to designsforhealth.com.
If you'd like to access other episodes or subscribe so you don't miss a beat, you can find us at nanp.org/NAMP-podcast.
Looking for a board-certified holistic nutrition professional to support you on your health journey? Go to nanp.org/find-a-practitioner and get started.
Membership in the NAMP provides you with a competitive advantage. Whether you're a current practitioner or a student, we want you to become an active, informed leader of the holistic nutrition community and join NAMP.org today. Are you ready to go a step further? Boost your credibility with board certification in holistic nutrition. Visit NAMP.org today to apply.
Keep in mind that the information on the NANP podcast is for educational purposes only and should not be considered medical or legal advice. The NANP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NANP and all agents. Copyright NANP, all rights reserved.
Until next time, stay nourished.